Hey guys, I'm Dwayne Stanley. I'm one of the instructors at Bevel. For those that don't know me, I'm the Grove instructor. Today we're going to talk about chest injuries. We're in chapter 29 and it's page 1045 in your book. Just a little bit about chest injuries. Just remember, 2 of the 3 things that can hurt you quickly are located in your chest, the lungs, and the heart. Today we're going to talk a little bit about the heart. It's quick anatomy. I know everybody here knows this by now. Your heart, 4 chambers, correct? Okay, today we're going to talk about the cardiac tamponade. Cardiac tamponade is when the heart is injured. All right, most of the time a cardiac tamponade is it can be caused by blunt injury, but most of the time it's about penetrating injury. A vessel has been injured, or one of the chambers has been injured and is bleeding. All right, you have a protective coating. Hard from the dummy here, and we're going to use this bag to simulate our pericardium, which is the protective covering around the heart. All right, what happens during a cardiac tamponade is you have your protective coating. When one of the vessels or one of the chambers starts bleeding, the pericardium, like I said, is a protective coating, and what happens is the blood gets between the heart and the pericardium itself. So as it fills up, I'm going to fill this up with water so we can try and see it. If I can get more water in here than on the floor. Yep. Hold on. All right, you can see, if you can see this, you have the water representing the blood between the heart itself and the pericardium. All right, now if this was the real heart instead of the hard one out of this dummy, the heart would be coming in. If you remember, you learned about pneumothoraxes in the past, where the air or blood on a hemothorax would push the lung in to prevent it from working like it's supposed to. This is going to do the same thing to the heart. And hence, that's where the problem is going to come in. All right, if the heart is being forced inside, if it's compressing the heart chambers, what's going to happen? The heart's not going to be able to pump like it's supposed to. Therefore, your cardiac output is going to slow down. If your cardiac output is being messed with, then your body is not getting the oxygen supply that it's used to getting. All right? If you remember in your shock sessions, in your shock lessons, then this is going to be an obstructive shock, just because your heart is being obstructed from being able to pump like it's supposed to. All right, there's 3 things that you need to look for in cardiac tamponade. It's called Beck's triad. All right, 1 is JVD, jugular vein distension. Both of them is going to be distended. If you ever see that, hopefully a light's going to go off. If that's the first thing you notice, a light should go off somewhere saying, hey, we've got a problem, and this could be our problem, especially if it's a chest injury. All right, 2nd, if you've been taking the blood pressure, you're going to have narrowing pulse pressures. All right, if you remember what that is, you have your systolic, diastolic pressures. They're going to start coming together. If you're taking your blood pressure like you're supposed to at least every 5 minutes, you're going to be able to tell that. Hopefully, if you've got enough people and if your patient is bad enough and you think something like this is going on, you don't have to wait every 5 minutes. If you've got enough hands, do it sooner than that so you can get an idea about what's going on. The 3rd one is muffled heart sounds, just because it is not working like it's supposed to. All right, like I said, this person is going to be going into obstructive shock. All right, you're going to treat this guy for shock, obstructive shock, just what it sounds like. All right, you remember your shock protocol. Everybody has been through shock protocol before. You're gonna get them laying down, which they probably already are at this point, but you're gonna cover them up, keep them warm, high flow O2 with a non-rebreather, and you're gonna transport them quickly. The definitive action for this guy is surgery. So the definitive action, the biggest thing is the transport immediately part, because that's the only thing that's gonna save this guy.